Introduction to Pediatric First Aid. Topics to be covered in this module. What is Pediatric First Aid? Provision of first aid in early years settings. Role of first aiders. Requirements in childcare. Minimizing the risk of infection. Personal protective equipment. First aid equipment. Storage and administration of medicines. Incident recording and reporting. Summary. Assessment questions will be included at the end of each module to ensure that you have understood the information. What is Pediatric First Aid? The basic understanding of first aid is the initial treatment given to sick or injured people until they are seen by registered medical professionals. Being a first aider and having the ability to care for fellow employees and bystanders is an admirable skill set and benefits the whole community. But the ability to be able to perform first aid on children and babies takes that skill to a whole other level. You'll need to take on other considerations, including increased empathy and patience. You will also need to change existing procedures, CPR, AED, etc., to accommodate a child's frame. The term pediatric basically covers the treatment of any child who has not yet reached puberty. This also covers infants or babies under the age of 1 year old. As a parent or a responsible adult, being trained in pediatric first aid will allow you to care for the next generation and possibly preserve an important young life. Provision of first aid in early years settings. UK Acts are in place to ensure that the appropriate number of paediatric first aiders, emergency first aiders, and basic first aiders are in place at any workplace or premises used by the general public. For childminders, teachers, and other individuals that come into contact with children, there are strict regulations that are set up by organisations like Ofsted, Office for Standards in Education, Children's Services and Skills, LEAs, Local Education Authorities, and the Childcare Register. As a paediatric first aider, you would be expected to liaise with appropriate site managers and/or fellow first aiders to make sure there are first aid kits and emergency equipment immediately available, as well as rooms and other facilities, running water, etc. Incident reporting and accident management systems in place, accident book, etc. Trained personnel in place at any one time to take care of and treat children. This is especially important in child-centric settings such as nurseries, creches, schools, leisure centres, and any local community centre. Role of first aiders. When attending to a young casualty, a paediatric first aider has 4 priorities, summed up by the acronym PAAP, PARP. Preserve life. Perform every action you can to sustain the well-being of a child until emergency services arrive. Alleviate suffering, comforting the child on an emotional and physical basis, along with appropriate pain relief. Prevent wounds from worsening. Treat the child's wounds as best you can, immobilize limbs if necessary, and dress incisions or burns. Promote recovery. Be mindful of a child's reaction to shock and ensure that professional medical services are aware of the situation. As a paediatric first aider, you also have to ask the following 5 questions as to your place of work or premises. 1. What is the risk to children? Is it a public place or closed environment? Are there exposed machinery, bodies of water, access to high areas, etc. available? 2. How many employees are around at any time? Take into consideration holidays and sickness. 3. How many first aiders do you need in the area? Think about possible emergencies and the likelihood of children being involved. 4. What accidents or emergencies have previously taken place there? Use this knowledge to understand what equipment and training you may need. 5. What other factors do you need to consider? Are there regular visitors? Do children have regular access, etc.?